Thank you for joining us. Oh. Hello, everyone. Thank you for joining us today on this presentation on COVID-19 and the related tests, treatments, and genetic vaccines. My name is Roy Gu. I'm the chair of the Pharmacy Practice Department, and I will serve as the moderator for today's presentation. This presentation was developed by two students from the Daniel K Inouye College of Pharmacy who are members of the student organization who normally put on the health fair every year. One little bit of housekeeping rules before I hand it over to the speakers is if you have a question during the presentation, please enter it in the Q&A panel, which is located on the bottom right of your screen. So please use that and not the chat function to enter your questions. We will answer questions throughout the presentation, as well as at the end of the presentation during the designated question and answer section. Again, thank you so much for joining us, and I will now turn it over to our speakers, Debra and Ola. Thank you.
Okay. Good morning, everybody. Good afternoon, I suppose it's noon now. Thank you for joining us. I appreciate everybody coming in today. My name is Debra Towell, and I am a second-year pharmacy student here at CKICP. And today I will be presenting the portion of the presentation over the current treatment studies and the approved treatments. And I will also be presenting today with Ola.
Okay. Good afternoon, everyone. My name is Ola Gbadebom. I'm a first-year pharmacy student at CKICP, and today I'll be presenting on the COVID vaccines.
Okay, so today our objectives are to understand what the coronaviruses are and the different types that are out there. We're going to identify the different COVID tests that are available. We're also going to discuss the treatment studies and the emergency use authorization treatments that have been approved, as well as the current FDA approved treatments. We will also figure out what the COVID-19 vaccine frontrunners are. We'll discuss what an mRNA vaccine is. We will also go over the drug approval process and how far along the vaccine is. And we'll give information about what an emergency use authorization is. Next slide. Okay, so here on this slide, we can see that there are 7 different types of coronaviruses. The first are the 4 most common, and they are associated with the human common cold that develop respiratory symptoms. These first 4 coronaviruses contribute to 15 to 30% of the common cold in humans. The 5th one on this list is the MERS COVID, which is the Middle East Respiratory Syndrome and had its first outbreak in 2012. The 6th one is the SARS COVID, which had a pandemic in 2003, but it was significantly smaller than the current pandemic. 7th one on here is the SARS-CoV-2, which is the current pandemic, which is also known as COVID-19. The COVID-19 has the highest fatality rate of all of the coronaviruses listed here, but the exact fatality rate is still ongoing and is currently unknown. The virus is thought to come from an animal species based out of Wuhan, China. Studies are still currently being conducted to find out the exact source, but studies indicate that the receptor binding motif shows that it is active in the bat lineage and may actually come from a bat that has been circulating the coronavirus since 1948. Next slide. Okay, on this slide, we're going to go over the COVID-19 testing options that are available. So this first one says Rtpcr, and that one stands for reverse transcriptase polymerase chain reaction. So this is our 72-hour molecular test. This is going to be the test that you're going to get a nasal swab. The process includes converting the RNA of the SARS-CoV-19 sample into DNA. You add primers with fluorescent dyes, and then the virus is able to duplicate on a positive case. This is going to be our most accurate test of the 3 tests that I have listed here. The second test is our antigen test. This is your rapid test that detects protein fragments. It's done in 15 minutes. and you can get the results via nasal swab. This test does have a lower sensitivity compared to the PCR test, which allows for more false positive tests. When traveling, a lot of times they want you to have a 3-day PCR test, so that's going to be your first 72-hour test, and then a second 15-minute test to confirm that you actually have a negative test. The last test here is going to be our antibody test. The antibody test is used only to determine if you have actually had COVID-19 previously, but it cannot detect a current active infection. Next slide. The approved treatments that we're going to go over are going to be just the remdesivir, but there are several trials that have been ongoing over the course of the last year. Today, we're going to be talking about the hydroxychloroquine and the HIV protease inhibitors, the Rebif, which is an interferon beta, and then the IgG1 monoclonal antibodies, and then finally the remdesivir. Next slide. So the first drug today that we're going to talk about is the hydroxychloroquine. This is an anti-malaria drug that is used for malaria treatment, lupus, and rheumatoid arthritis. This medication received an emergency use authorization by the FDA in March of 2020. This authorization earned a lot of media, and many thought that this drug was going to be the treatment for COVID-19 patients. However, on June 15, 2020, this emergency use authorization was revoked by the FDA. There have been 2 clinical trials, and both trials reported no significant benefit for treatment with the hydroxychloroquine, with or without the addition of azithromycin. In fact, it actually resulted in more adverse effects, such as cardiac arrhythmia and even death. So the hydroxychloroquine is not a recommended drug for any COVID-19 patient. Next slide. The next one we're going to talk about is our HIV protease inhibitors. So a protease is an enzyme that breaks down proteins and peptides. The graph to your right in this presentation shows one clinical trial that used several HIV protease inhibitors. The first bar that you see in that graph is the placebo, the DMSO, and it shows that there is no drug that is significantly higher or lower than the placebo drug. So the results indicated that there was no inhibitor, none of the protease inhibitors that inhibited the main protease in the COVID-19. So the only way that the inhibitors actually worked is if it was given at high concentrations. And when it was given at high concentrations, it would actually result in cell death and cytotoxicity. So it's thought that protease inhibitors may be used in the future with a different target in the COVID-19, but the main protease is not going to be one that will work, and no future studies have been conducted yet. Next slide. The next drug we're going to talk about is the Rebif, which is our interferon beta. So interferon beta is a polypeptide that is normally produced by a fibroblast that has an antiviral and anti-proliferative effect and is currently used in multiple sclerosis patients. Scientists believe that the interferon beta may be the most promising drug against SARS-CoV-19, since our bodies naturally produce interferon beta and is normally, it's very similar to the form our body produces a very similar form. In May 2020, a trial was approved for phase 2, and the trial will be a randomized controlled open label phase 2 clinical trial that will study 2 primary outcomes. So those primary outcomes are reducing the infectivity of patients with mild to moderate symptoms and also reducing the duration of their hospital stay. So in February 2021, they will begin the randomization process for this trial. Next slide. Okay, so the IgG1 monoclonal antibodies is part of the IgG, which is the most common antibody in the human body. So here we can see that there are 2 FDA emergency use authorization drugs. So the first one is the Bamlanivimab, which was approved in November of 2020. And then the combination of the Curicivimab and the Imdevimab was approved in November 2020 as well. Both of these drugs are approved for outpatient use in mild to moderate COVID-19 in adolescents ages greater than 12 and greater than 40 kilograms in weight. It is only used for outpatients who are at risk of progression to severe disease and or hospitalization. Next slide. So the last drug we're going to talk about today is the Remdesivir. Remdesivir is a nucleotide prodrug. The active metabolite inhibits RNA-dependent polymerases, which are enzymes that play a key role in the replication of the viruses, including coronavirus. Prior to approval, there were 3 randomized controlled trials completed and analyzed. The overall result reduced the mortality rate of coronavirus from 15% all the way down to 11%. Drug therapy for COVID-19 is going to be continuous and ongoing as we move forward and have treatment options such as Remdesivir, which is a great option and currently the only FDA approved option. But really, prevention is going to be the best and is the goal of the COVID vaccine. So next in our presentation, we're going to see Ola go through the process of the Operation Warp Speed and the current vaccines that are available to us.
Okay, thank you, Trisha. Or thank you, Debra. So I'm going to be going over Operation Warp Speed. So Operation Warp Speed was the US's initiative to speed up the production of vaccines. So these 5 companies were selected for Project Warp Speed. These companies were given additional government funding, clinical trial assistance, and manufacturing help. Operation Warp Speed's goal is to produce and deliver over 300 million doses of safe and effective vaccine, with initial doses available by this month. And then next, I'm just going to quickly talk about how do vaccines work. A vaccine is a substance that helps protect against certain diseases. Vaccines contain a dead or weakened version of a virus or pathogen, resulting in antibody production. These antibodies help your immune system recognize and destroy future viruses for future infections. And then here's a list of the current vaccines that we use today with examples. So we have the live attenuated vaccines, such as the MMR vaccine. We have inactivated vaccines, like the flu vaccine. There are subunit vaccines, like the HPV vaccine, toxoid vaccines, like the DTaP vaccine. But today, we're going to be focusing on these 2 new vaccine approaches. A thing to note is that before the pandemic, there were no commercially available vaccines that use either of these 2 methods. So quick, here's a picture of the coronavirus. These red structures are called spike proteins. Our immune system uses these spike proteins to recognize and respond to viral infections. So I just wanted to point them out. So it's all these little red structures on here. And then so on the right is what happens upon injection of a mRNA vaccine. So the vaccine contains a single-stranded mRNA inside a nanoparticle bilayer. So got a little illustration right here. Once injected, it leaves the mRNA in the cytosol. So right here is the mRNA in the cytosol. There, ribosomes translate the mRNA into a spike protein. So here's the ribosome translating into a spike protein. And then this spike protein primes your immune system in case of infection. So this is our immune system, and it's producing antibodies, so it can quickly respond in case of an infection. And then here are the 2 vaccines we have that are using this mRNA approach. We have the Pfizer partnered with BioNTech, BNT162b2. This vaccine is given as 2 doses, given 3 weeks apart. If this vaccine is stored at 25 degrees Fahrenheit, it's good for only 5 days. If we cool it down to -94 degrees Fahrenheit, it's good for up to 6 months. And on the right, we have the Moderna mRNA 1273. So this is also given as 2 doses. So this is given 4 weeks apart, and at 25 degrees Fahrenheit, it's good for up to a month. And then here is an illustration of a viral vector vaccine, so the other genetic vaccine. They use a non-replicating virus that won't cause disease, such as the chimpanzee adenovirus in this case, shown here in purple. Inside the virus is blue, inside the virus in blue is DNA that encodes for the coronavirus spike protein. So right here inside the virus. So after injection, it enters the cell and takes that spike protein DNA into the nucleus. There is transcribed into mRNA. It leaves the nucleus and ultimately gets transcribed into spike proteins that prime our immune system, just like in the other approach. So you can see it here, it's in the nucleus, and then it goes and then produces spike proteins ultimately. This vaccine is also, so here's the Astrazeneca, and they did use the viral vector approach. So this vaccine is also given as 4 weeks apart. They have 2 doses 4 weeks apart. Because it is not that, the mRNA is a little fragile, so this one's a little bit more stable, so it can be stored between 36 to 46 degrees Fahrenheit, and is good for up to 40, or good for up to 6 months. So here's a quick overview of the drug approval process, all the way from drug discovery to approval. The part that I'll be focusing on today will be the clinical trials. There's a quick overview of the clinical trials. So there are 3 phases in the 3 main phases in the clinical trials. The first phase basically is checking for safety of the vaccine. The second phase is checking for adverse reactions. And the third phase is checking to see how well it works. And then these are the 3 companies. So these 3 companies we'll be going over what they did during their clinical trials briefly. So first we have the Modernist clinical trials. They gathered more than 30,000 participants. A thing to note is that the endpoint in their study was to check for symptoms after 14 days. So after the second injection was given, they waited 14 days and participants were to call in if they were experiencing any sort of symptoms. They split the participants into 2 groups, one being the placebo group. The placebo group would be the control group that did not receive the actual vaccine. Instead, it received saline, normal saline or sterile water in their injection. The purpose of the control group is to have something to compare to. This is so that they can be sure that the vaccine is actually yielding the results that they see. So half of them were in this group, about 15,000 subjects. And of that, 185 of them reported having COVID symptoms. 30 of that 185 were severe cases. And on the other side, we had the subjects that actually received the active vaccine. 11 of them did report symptoms. Okay, and the next, in the Pfizer study, they had about 43,000 participants. The endpoint of their study was to check for symptoms after 7 days. If symptoms were reported, they were to administer a COVID-19 test just to confirm that that COVID-19 was responsible for the symptoms. And in their placebo group, they had about 21,000 people. 162 of those people reported symptoms, and 9 of those were severe cases. In the active vaccine group, 8 of them reported symptoms, and one of the cases were severe. So what does this tell us? From these studies, we can tell that these vaccines prevent symptoms, but we're still not sure if they prevent infection because that was not part of their endpoints. Last, there was the Astrazeneca clinical trials. They had about 11,000 participants in their study. The endpoint of their study was to check for infection actually after 14 days. So at the 14-day mark, after the second dose was given, they tested every one of their participants, so all 11,000 people were tested for COVID. In their control group, they had about 101 people infected with COVID. And in the active vaccine group, they had about 30 people that developed an infection. And in their study, they didn't have any severe cases. So another thing, so one thing with all these studies, we don't know how long immunity lasts. AstraZeneca did a good job by checking for infection for testing everybody, but we still aren't sure how long immunity lasts. Something we do know is that all 3 of the studies were deemed that there were no significant safety concerns post-vaccination, but this is still getting monitored. And then so what this is all leading up to is all the vaccine candidates and companies we're hoping to gain emergency use authorization. Emergency use authorization allows the FDA to temporarily approve medical countermeasures needed in public health emergencies. Just another thing to note, this does not constitute full approval, but instead allows the FDA to basically get something out there if we're in times of crisis. And on December 10th, 2020, Pfizer's mRNA vaccine was authorized to be given to people 16 and older. And on December 17th, Moderna's mRNA vaccine was authorized to be given to people 18 and older here in the United States. Looking ahead, starting early this year, many other companies developing vaccines are hoping to gain authorization. And to give a projection of how many doses these top 3 companies will be having for this year, Moderna is on track to have between 500 million to 1 billion doses this year. Pfizer is looking to have up to 1.3 billion doses, and AstraZeneca hopes to have about 3 million doses ready for this year. And then for distribution, so these vaccines are going to be rolled out in phases. The first phases are going to be, so we have 1A, phase 1A, where healthcare personnel and long-term care residents will be getting the vaccine. Next, it'll be essential workers. And then after that, in 1C, adults with high risk medical conditions and adults 65 and older will be getting it. And after all these groups have been covered, then the vaccine will start rolling out to other groups. So while you're waiting for the vaccine, we still don't know everything about COVID. So while we're waiting, it is advised that everyone, including persons who have received both doses of the vaccine, should continue to follow FDA recommendations on wearing a mask, social distancing, and frequently washing your hands. And I just want to take a moment to thank Dr. Gu for helping Debra and I prepare this presentation, and Tracy for everything he did with the health fair and setting up this webinar. Any questions?
Well, thank you so much to both our speakers. So if there's any questions that you have, please, again, enter them in the Q&A tab on the bottom right of your screen or window. Okay, one question that came through is, what were mild and severe symptoms of the vaccine?
Yeah, that's a good question. So the mild, severe symptoms of the vaccine, so people, they got the vaccine, they said they experienced pain at the injection site, fatigue, just general muscle and joint pain, and headaches.
Another question is, one of the participants is scheduled to get their vaccine tomorrow. Should they take it easy the rest of the week?
I say that wouldn't hurt. I would say definitely if you experience like strong reactions to other vaccines, maybe take it easy. But I would say it wouldn't hurt if you had time to take it easy. It wouldn't hurt.
Yeah, it generally it's not necessary to take off of work or anything like that. But again, usually the feelings of malaise and flu-like symptoms do last a day or even a couple of days in some instances. So again, as Ola said, take it easy, monitor yourself would be the best advice. Another question is, I heard about Moderna's half-dose plan to increase the number of vaccines that can be administered. What are your thoughts?
I did hear about that. I know that the whole idea behind that is that production is a little bit slower than they anticipated, and they're trying to just get more coverage out. So they did test to see how much coverage someone would have, or versus against the virus against with just the first dose. And I'm not really sure about like production and how, like I'm sure they're probably forecasting like how fast they can get things out, and maybe this might be a better approach. So if they deem that that's the way to go, then I would agree with them.
Yeah, well, the most recent news is that the FDA has approved for actual drawing up of an additional dose for the Moderna vial. So basically the Moderna vials are meant to be 10 doses. But in some cases there is some what we call overfill, where they fill the amount of vaccine they put in there is actually enough to do 11 doses. So of course that's dependent on your technique in drawing it up and the type of syringe that you use. But actually it looks like we will be able to squeeze in many cases another dose out of the vial for Moderna. Another question, is there any information about how many vaccines Hawaii will receive? At this point, that's still coming in. We're not sure at the schedule or the rate at which we'll be receiving vaccines, but they are slowly coming in. Okay, well, if there are no further questions, thank you everyone so much for attending this presentation. Oh, I'm sorry, there actually is a couple more questions. For the sample subjects of the phase 3 trials of Moderna, Pfizer, and AstraZeneca, are they healthy adults or do they have comorbidities?
Yep, so the majority of the subjects were healthy adults, but they did make sure to include subjects with comorbidities and people 65 and older, just to have a better picture of the general public.
A great question here is, as a future healthcare provider, how would you explain to your family and friends who are reluctant to get the COVID vaccines because of safety issues?
How would I explain it? I would say basically, I mean, the benefits outweigh the risk versus, I mean, the side effects from this vaccine versus the side effects that we're seeing from people that have COVID, and possibly, if you get COVID, you don't know, usually there is a trend of more people that are more susceptible to basically dying from the disease, but still you don't know. So I would just say kind of tell them the benefits outweigh the risk on getting the vaccine.
Great answer. Another question is, you said the endpoint infection prevention, endpoint of infection prevention was only tested by AstraZeneca. Can you explain how the Pfizer and Moderna would be beneficial to give? So basically, the benefit to the other vaccines, although they are in the process of testing whether or not the vaccine actually prevents infection, is that what we do know is that it prevents severe infection. So it reduces your risk of having a severely symptomatic infection that would land you in the ICU and or on a ventilator. So it decreases your mortality rate. It basically decreases the impact of the infection, if not the infection itself. Okay. Another question is, what are the more serious side effects from the vaccine? Guillain-Barre syndrome and Bell's palsy. Were any of those noted in the studies, Ola?
So during the studies, I don't know if those were noted, but I do know that, especially the Bell's palsy, I do know that they did witness, I think it was 4 people. They did witness 4 people that experienced Bell's palsy, but I don't know if because I know they're trying to determine whether it was a vaccine or not, or like for sure if they could fully link it that was a vaccine or not. But in the studies they didn't mention either of those.
Another question is, were the ethnicities of the subjects taken into account? Specifically, are Native Hawaiians affected differently or have a lower level of effectiveness when compared to Caucasians?
They did take into account having different ethnicities and races into the study. Specifically for Hawaiians, I'm not sure because they kind of named everything kind of general for the different ethnicities and races. But they did take that into account, and they tried to, because the studies actually not all the studies were conducted here in the US, so they did try to spread them out to try to get a better sample size than just having it all homogenous like Caucasians.
Also keep in mind that we're basically in one big study right now. As people are getting the vaccine worldwide, we're continuing to collect data, and we'll have more data on different ethnicities as well as different comorbidities and things like that. A very good question here is, what happens if you miss the second dose? So for example, if you go more than 3 weeks for Pfizer or more than 4 weeks for Moderna. And so the answer to that is, it's like like any other vaccine where if you delay the time to the second dose or the next dose in the series, it doesn't decrease the effectiveness of the vaccine, but it does delay your time till you're fully covered. Now, so it's actually better to get the vaccine late as opposed to getting the vaccine early. If you get the second dose too early, it may compromise the overall efficacy of the vaccine. So that's a general rule that holds true for any vaccine that's a series, including hepatitis B and other vaccines. Is the vaccine safe in pregnant women?
Well, in the clinical studies, they didn't have pregnant women, but I do know they are encouraging pregnant women to get the vaccine.
Since the vaccine is fairly new, through experimentation over the past 10 years that they took to develop and study this vaccine, do we know of any long-term effects? So at this point, no, we don't know of any long-term effects. The studies were too short, and this is, as you said, too new. Okay. Anyway, we're at 12:30 now, and unfortunately, we are out of time. So thank you, everyone, for participating, and we hope to put on more of these presentations in the future. So thank you. Have a wonderful day.
Thank you.
Thank you, everybody.